Yes, good morning mga katribo. It's Wednesday, November 29. Welcome to another episode of Daily Tribune's Straight Talk, where we discuss current issues that matter to each of us. I am Gigie Arcilla.
Morning, Gigie. Good morning, guests. I'm Chito Lozada. We are on Daily Tribune Facebook page and Tribune Now on YouTube.
And in this morning's episode, we are joined by, how can we describe this, Chito?
They are the
yes.
dentists of celebrities.
Yes, they are the dentists of celebrities. Let's welcome our esteemed Doc Lito, Doc Mia, and Doc Nelda from the Center of Advanced Dentistry. So in short, CAD.
CAD.
Oo, parang IT di ba? CAD.
Good
Yes,
morning.
Good morning. Good morning,
Thank you for
doctors.
having us.
Yes.
It's our pleasure.
Welcome to the show, and thank you for gracing our invitation.
Pleasure is ours. Thank you.
All right, so fire away. So Chita, we ask the first question.
Yeah, can you give us the how you started with the CAD?
Okay.
You gave us some background.
Brief
earlier,
background.
Brief background.
Yeah, we started out in a very small clinic in Makati, in Legazpi Village to be exact. We catered to most of our patients are from models who will be trying out for a commercial. And then eventually we're able to get talents for close-up commercials. So prior to any
Close-up
shooting,
the
close-up the toothpaste, yeah. So prior to any shooting that they will have to produce the advertisement or the commercial, we would fix their teeth. So from then on, lumaki na ng lumaki until word of mouth. Kasi before, wala pang social media. So from there, nanganak na ng nanganak. So a lot of the modeling agencies and the advertising companies, including J. Walter Thompson, uso pa noon. So they would really bring in their talents and we would fix them up. Kasi it's a quick fix. So if they bring in the talents today, they can shoot tonight. So they're very happy with that. And then, word of mouth came about.
Before
around
you,
town.
walang gumagawa.
Well,
Fixing
I'm not too sure, but
dent-
I am pretty sure that we pioneered in the field of aesthetic dentistry.
Yeah, before kasi parang people would just go to a dentist pag masakit yung ngipin, right? So now it's
Gone are the days.
Gone are the days na ganon. So now they go for commercials for beautification.
aesthetic.
Aesthetic.
I'm glad to say po that Filipinos now are more dentally aware
Yes.
than before. Kasi dati po talaga, pupunta lang sila sa dentist if masakit nga yung ngipin. But now, they want nice smile, nice teeth.
Parang ang laking tulong ng social media,
I guess that's
for
one of
the
the
Positive side po of social media.
the awareness.
that created awareness for people to have nicer teeth now.
So ilang taon na ang CAD? I mean, since
You would see our pictures, Ma'am Gigie, di ba? Batang-bata pa kami.
Hindi, sa akin parang 1
Parang
year
kahapon
lang.
lang.
20 years.
Like
for
20 years.
20 years.
Oh.
Yes.
That's good.
So that's 2003.
2003.
Yeah.
In Makati. So
Even
now,
earlier pa.
Earlier pa, parang mga late 90s.
so how many branches do meron na ang CAD?
We maintain the two because we want to be present in all the clinics. We really are hands-on. And we don't really want to
Spread ourselves
too thin. That's why we still have, but of course in the future we're really, that's in the pipeline that we're gonna expand
Expand.
later on. But right now we are really trying to take care of all the patients who come in.
Siguro that would be the time yung pwede na kayong i-clone,
Clone.
I-clone na tipong all the
company.
clinics you are
Yeah,
present.
pero we still have to be there eh. We want to assure all the patients that we are going to be there for you. It's all our hands, the hands of
Talagang,
Dr. Lito, Dr. Mia, and myself who will really take care of you.
Yeah.
May
Iba pa rin,
personalized.
personal touch.
Oh,
Yes, that's
personal
Yes.
touch.
So itong question ko. What sets CAD apart from all the, I mean,
Dental clinic.
from all the centers that offer innovative
I guess when they say CAD, it connotes parang the expertise of the doctors. It's the pride of ownership that they're going to wear the veneer. Especially, we really, of course, CAD is known for centering aesthetic dentistry. Our practice is centered on aesthetic dentistry. And one of the holy grails of dental procedures that we do is veneers. We call it CAD ultra-thin veneers. So we can assure you that you will have that pride of ownership when you wear the CAD ultra-thin veneers. That's one of the main reasons why people around the world, ma'am, also we're thankful to the social media. They fly into CAD to have the CAD ultra-thin veneers. 90% are coming from abroad just to get the CAD
Oh, yeah?
ultra-thin
so meaning
veneers.
CAD is also a contributor to
Yes, ma'am.
dental
Proudly Philippine-made.
dental tourism.
Yes.
I'd like to think that,
Parang
yeah.
Yes.
parang it's my
Correct.
first time kasi I always some
Yes.
years back.
So that was
You'll be
medical
surprised.
tourism. So
Yes.
meron na palang dental tourism.
Yes, ma'am. 90% of our patients are flying in from abroad.
so the technology is Filipino, the veneer
Yes,
technology.
yes, but we source out our materials abroad.
So if you look, if you're abroad, you cannot find
No, you
anybody
can't.
who can.
We are the best in Asia. Sorry.
Sabi
Hindi
mo,
makakat to, no?
Doc
It's interesting.
Nelda, sabi
Yeah.
mo nga 90% of your patients are coming from abroad. Translate natin yan sa numbers.
Doctors, will you help me with that?
Translate natin sa numbers.
Marami talaga.
Marami.
I mean like
Let's a scale
a ballpark
one,
figure.
no, 1 to 10, baka 8 out of 10.
From what country? Usually.
Japan.
Japan.
So meaning yung
UK,
So
US.
meaning yung marketing ng CAD is not just in the Philippines. So it's
Yes, because we're on
Yeah.
Instagram, so they see it.
Social
So
media,
they're thinking, if they spend too much there, parang it's better to do it in the Philippines kasi aside from doing the teeth, they can go on
Nakakauwi
vacation
pa sila, di ba?
and see their
Nakakabakasyon
relatives.
and nakikita yung family.
Exactly.
dental
And
tourism
mostly po din kasi word of mouth din talaga from
from other
patients talaga na we nagawa namin, and then
Correct,
when they
correct.
return abroad, makikita ng mga coworkers nila.
So the expansion plan must be to also base to put up an office, a branch
a
abroad.
clinic abroad.
Well, we have to take the board exams in the
Ayun.
in the country.
That would
Like
be
in the States, yeah, oo. We can't
hurdle.
practice here.
Oo.
But you also have a set of dentists
Yes,
in
we
your
do.
in your
Yeah.
clinics.
We have associates. So.
Yes.
And
So
your-
cloning,
Yeah.
maybe it's possible.
Cloning.
Hopefully, we can teach them all the detailed work so they can have the talents from
So how do you
all the
do it
doctors,
if you have
senior doctors?
How do you do it, Doc? If you have like you said you maintain 2 clinics at BGC and
Green
in
Hills.
Green Hills.
Hinahati namin, Ma'am
So
Gigie.
meaning,
Or we shuttle
Lagare,
for
and then
Lagare.
you go to
Talagang
Correct. Kasi
personalized
sometimes
na.
a specific
The patients
patient
will-
will request for a specific doctor. So we have to morning in Green Hills or in BGC and then palit. Ayun. That's
Pero-
how dedicated we are.
And hindi ba kayo naaapektuhan ng traffic because you have to go to 2 clinics in one day?
We're sanay na.
Maybe the plan is to buy a helicopter.
That's
in
the
the
best,
future.
sir.
Yeah, especially
God willing.
especially if they want to put up a clinic abroad.
Abroad,
like
God
in
willing.
Asia.
Pero sino ang nyo? Mostly who are mostly your clients? Celebrities, politicians.
Yes, mostly.
Oo, syempre may dental,
Yeah.
may privacy eh.
Yes.
So,
Pero we get a lot of inquiries. Tinatanong nila when they call CAD. Kasi pang celebrity lang po ba ito? So sinasabi naman namin, hindi po kayo ang priority namin dito. Each one of
Kayo
you
ang
will be
celebrity.
treated like a
Like a
celebrity.
celebrity.
Hindi porke celebrity-based tayo. Hindi po. Lahat, we welcome everyone and you will feel like a celebrity when you walk in CAD. The same quality and service.
actually, nakikita ko yung word na veneer sa social media. Yan, nakikita ko yan sa Facebook, sa TikTok.
Yes, it's very
And
Yeah,
then,
it sounds
ano ba-
expensive.
yeah. Ano ba talaga ang veneers? I
Oh.
mean, just a very brief explanation.
Veneers are thin wafers of porcelain. Think of it
Porcelain.
as your fake fingernail na pinapatong sa fingers nyo.
So, nail polish.
very, very thin.
Yeah.
Yes.
Ganun po kanipis yun, parang contact lens. Then you put it on top of a natural tooth. So you need a natural tooth for it to work. So without that, hindi pwede mag-veneers.
Kailangan natural. yun.
Kailangan may natural teeth para patungan yan.
How long is it, will it last?
The shelf life usually,
5 years and up. It will really
Yeah.
depend on the patient's oral hygiene and
oral
habits.
and
So,
patient
syempre,
compliance. Kasi hindi pwede kumagat ng matigas. That's really the downside
Yan ang
of it.
problema
It's a,
nun.
face it, it's a fake tooth.
So, bawal ang chicharon.
Yun ang pinaka number
Corn
one.
on
Tsaka
Pwede
raw-
naman
Yeah.
anuhin,
You
ganun.
cannot
Tsaka raw
challenge
lechon.
bawal yung
Lechon na
Lechon.
matigas, pwede naman basta ano, i-crack nyo
dainty
lang.
lang
Oo.
pag-
Bawal ang Tootsie Roll.
Medyo yung
Hindi
Tootsie
pwede
Roll.
yun.
Medyo baka dumikit.
Didikit na yun.
Although it's cemented properly and cemented, seated well on the tooth, best to avoid na lang yung mga ano na bawal kainin.
I'm curious about how long does the procedure take?
It's very quick. Doc Lito, how long?
Well, normally, for ideal cases mo,
Bilis lang.
mga 10 working days to 2 weeks.
To
Pero
complete the
there
procedure.
are cases kasi na, well, sabi ko nga doon sa mga patients din po, not everybody is the same treatment. Kasi subjective the treatment eh. So if there's a degree of difficulty, minsan nag-extend kami ng konti. Pero normally po, with ideal
Ideal
cases, mga 10 working days to 2 weeks, tapos na po.
Yung ano ba, para akong batang magtatanong eh. Kasi sabi niyo nga parang it's like a nail polish, di ba? So, yung polish kasi, it takes like, minutes to dry. So, does that mean the veneers, when they're applied on the natural tooth,
Ano ma'am, it's a
Fake
Shell, it's like a shell
It's
Fake
a
fingernail.
that you put
fingernail.
on top of your
Parang
tooth.
pinoprocess din po siya sa laboratory. So that will
Ano
take
yung
siguro mga
adhesive?
1 week.
Parang
Cement, it's a fluoride-releasing cement. So,
Ay, nilalagay rin sa...
yes.
naka-mold din siya.
Yes.
Yes. So parang 'di ba ma'am, 'di ba you have the fake fingernails. Parang ganoon yung itsura niya na ipapatong on each tooth.
The only difference lang po is yung fake nail kasi di ba prefabricated po yun eh. Yung veneers talagang inaano po siya.
Indirect.
So,
Yeah.
it's a transparent thing.
No, it's to
It
color.
has a lot of shades,
Shades.
to choose
kaya
from.
pala.
It's
Sometimes,
lifelike na
I
rin.
see na parang sobra-sobrang white yung color.
It's tailor-made for each patient. So iba-iba yan.
Their preference.
Yeah, so it's customized.
customized.
Oo. So for you, hindi, ma'am, we always suggest the bleach color shade, it's too white for you kasi depends on the
Skin tone.
skin tone of the
Skin
patient. So we tell them, hindi bagay to sa inyo. Or ay bagay to, maputi ka. So you can use that, the whitest shade. So may a lot of shades to choose from. From the bleach shade to the natural colors.
So, yun pala.
Very interesting.
So, wag muna natin tanungin,
Yun na.
Chito, how much does it cost? Diba?
Hindi naman...
Kinabulong ko na lang, Sir Chito.
Yeah. Ang tanungin natin, ano
Ano
pa
yun
ba
eh?
yung ibang
Trade secret
Yeah,
siguro yun.
What are the other services? Kasi kung
Oh.
traditional dentistry,
Kung Holy Grail
alam mo,
yung...
di ba?
Yes.
cleaning, di ba, prophylaxis.
Yes.
And then there's the jacket, and then there's
Implants.
the implants,
Yes.
fixed bridge. Ano pa ba? Which,
We carry all the general dentistry, general dental procedures, like, of course, the cleaning, the whitening, the
Restoration.
all the mga pasta, fillings, restorations yung tawag doon.
Dentures.
Prosthodontics, dentures, pustiso, lahat, what have you, under the sun, everything we have it. We have consultants for each field, for each department, like for prosthodontics, for surgery, we carry dental implants also as well. But the restorations will be from CAD clinic. We have the natural looking restorations from jacket crowns to fixed bridge, and of course the veneers.
Ano pinaka-challenging na naging nyo, client?
Madami.
Araw-araw yan.
Every day is a challenge.
Yeah.
So ano tong mga challenges na to?
Of course, some
Wala.
people would expect a lot kasi nga they would be spending a lot on their teeth. So, in-expect nila.
Ako, I have a good one.
Magic.
Ano?
Oh, I have a
They
good
would-
one.
Ano yan?
Sometimes, they feel na dapat kamukha ko si ganyan.
Yes, yung mga ganyan. I was gonna say.
Naku po, parang ngipin lang po kami. Parang, wait lang po.
Mo ba?
Parang we only concentrate on the oral cavity po. Hindi na kayo.
Tsaka parang hindi yata namin pinag-aralan yung magic.
Yes,
Magic.
Sometimes they're asking for magic na.
Ano sinasabi nyo?
Alam ko, sir, meron akong isang experience.
Si Doc Lito.
Dentures po ito. Complete dentures. Sabi ni Daddy, complete. Wala na siyang ngipin.
Oh, okay.
So, I made
Entirely
a
wala lang. Bungal
complete
na po.
denture for him. Sabi niya sa akin, tinanong niya ako, sarcastically na medyo may pagka-offensive na ng konti yung dating. Sabi niya sa akin, ito ba, pag namatay na ako, hindi to masisira. Sabi niya sa akin.
Ay, hindi
Sabi
naman
ko,
talaga.
sabi ko, sir, sabi ko, syempre po, kailangan niyo po ingatan yan. Sabi ko, kung halimbawa po, nabagsak yan, syempre may chances po na mag-crack yan. Sabi ko, tsaka po, una-una, sir, gawa ko na lang po yan. Kung yung gawa nga po ni Lord, inubos nyo. Gawa ko pa. Sasagot niya sa akin, oo nga naman.
Baka nanonood si Daddy.
Ano yung satisfy mo yung
Hindi,
tanong niya?
dami naman, Doc Mia, ng mga daddies. I mean, it's so hard to, single out.
Correct.
Yeah, so nakakatuwa.
Sana
na.
makilala namin.
Ay, masaya,
para
masaya
malaman
rin.
namin kung maganda talaga.
Masaya
yun.
sa clinic, madaming challenges. But
And
we try to-
characters. Alright, so balikan natin yung mga dental tales.
Oh, maybe we can ask about the dental health
Yeah.
sa mga Pilipino.
Sige. Balikan natin yung tales ng ating tatlong esteemed dentist right after our commercial break.
Yeah.
This break is brought to you by Angkas, Beat the Traffic, Bayad Center, hashtag Bigger Better Younger Bayad, and you can buy it all. Globe, atin ang mundo. Meralco, ang liwanag ng bukas. SM, we've got it all for you. Smart, live more today. Union Bank, it starts with you. A wellness show dedicated to empowering viewers with the knowledge and inspiration needed to lead a healthy lifestyle. Be Well Now, hosted by Miss Cory Crino, every Wednesday at 2 p.m. only here at Daily Tribune's Facebook page and Tribune Now in YouTube.
Alamin ang pinakamaiinit na balita at mahalagang issue na bumabalot ngayon sa ating bansa. Ating pag-usapan, blow by blow, dito lang sa Hot Patatas, kasama sila Chicky Mangkukang, Vernon Velasco at Gio Leaño. Yung Lunes, Miyerkules at Biyernes, alas 3 ng hapon, dito lang sa Daily Tribune Facebook page at Tribune Now sa YouTube.
Conversations that are masterclasses from the top honchos of various industries. Learn from their strategies and insights so you yourself can unlock your full potential. Perfect every Friday at 2 p.m. only here on Daily Tribune's Facebook page and Tribune Now in YouTube. Creative minds, entertainment icons, style influencers. We shine the spotlight on remarkable individuals who shape our cultural landscape. Every Tuesday at 2 p.m. only here in Daily Tribune's Facebook page and Tribune Now in YouTube. Parayan at talakayang showbiz times 2, doble-doble. Kasama ang dalawa sa walang kupas na talakayan ng showbiz, Alwin Ignacio at Alex Brosas.
DTT Show, tuwing Sabado at Linggo, alas 4 ng hapon. Dito lang sa Diaryo Tirada ng Daily Tribune.
Straight Talk dives deep into present issues of leadership, politics, business, and more. Engage in insightful conversations with industry shakers, government leaders, and trailblazers every Wednesday at 10 a.m. only here on Daily Tribune's Facebook page and Tribune Now in YouTube.
We are back. You're still watching Straight Talk. Still with us are Doc Lito, Doc Mia, and Doc Nelda from the Center of Advanced Dentistry. So, tanungin natin. During commercial, naisip ko, marami kasi tayong mates. Di ba? Dahil napag-usapan nga natin that, some people, they don't give much importance to, going to the dentist, dental care. So, ano ba yung mga myths na dito sa Pilipinas, maraming myths di ba? And then, they tend to believe yung iba naman pala, hindi naman pala totoo. And it's even more, dangerous to the dental
Yung
health.
mga nakukuha niya sa mga patients.
Like, sabi nila, pag sumakit, sasagutin niyo lang. Sabi nila, pag sumakit ang ipin mo, lagyan mo ng bulak with pabango, and then isalpak mo dun sa area na masakit.
Eh, baka malason pa kayo doon, di ba? Siguro, suggest natin, punta na lang kayo sa dentist para mas, ma-address nila yung
how about
toothache
putting,
niyo.
a crushed garlic there?
Well, ma'am, kasi yung mga, kagaya ng pabango, tsaka yung bawang, manghang kasi yun eh. So sometimes, it has a sedative effect. Kasi yung nilalagay namin sa na treatment for, kunyari, the zinc oxide, the
Eugenol.
The eugenol. Ano yun eh, sobrang anghang din siya eh. So may sedative effect siya. Siguro parang ganun yung naiisip nila. Since
Dahil sa
maanghang siya,
Nadadivert
yung attention
yung pain.
dun sa anghang kaysa na nararamdaman nila yung pain. Siguro ganun yung nangyayari. Pero nung bata ako, parang di ko naman yata naranasan din kasi. Kahit hindi pa ako dentist. Pero nadidinig ko na yun before.
Para hindi mamaga. Baka mamaya mamaga pa yun eh.
Totoo ba yung sabi nila that when brushing your teeth, you don't need out na to rinse na sobra thoroughly. Medyo iwanan mo daw nung of the toothpaste. Is
Parang
that true?
matamis yung toothpaste eh.
Totoo ba yun?
Kasi sabi nila, 'di ba kasi yung toothpaste has fluoride. So siguro kasi yung absorption kasi ng fluoride sa bata lang yan kasi hindi pa talaga highly what do you call that calcified yung ngipin. So pag matanda na tayo, as we grow old,
Tumitigas na
calcified na
yung ngipin.
talaga yung bone. So
Hindi
yung
napapasok.
absorption ng fluoride sa ngipin hindi na talaga effective. So, I suggest you rinse very well. Kasi if not naman, parang the toothpaste itself, baka yun yung mag-cause pa nung...
Minsan, mahirap din yung social media. May downside din. And,
So kasi Dr. Google, please,
Google.
make sure and confirm.
Marami pong patient na nag-consult muna kay Dr. Google bago pumunta sa amin. So sometimes I
Alam na
ask
nila,
them,
di ba, pagpunta nila doc sa clinic.
Yes.
Sabi kasi, nabasa ko sa, di ba, sa Google. So, always confirm.
With your dentist.
so it just shows na resourceful talaga ang tao.
Correct.
You
Yes,
know.
yes.
Pero how regular should one
Ayun.
person
Visit.
visit a dentist?
Usually, it's twice a year, every 6 months.
Twice a year.
Yes. Just to have everything checked. Prevention is always better than cure, di ba po? And we have to go down to the basics. Good oral hygiene.
May question ako about kasi how do dentists, of course you have an association, how do dentists make sure that concern din nyo to, I'm sure. You know, the proliferation of, you know, fake dentists, and also the proliferation of, you know, fake, hindi mga licensed na mga technicians.
Ang dami niya.
Na gumagawa ng, alam mo yun, they would
Madami.
offer like, you know, braces or,
Do it yourself.
yeah, do it yourself. Eto, kasi minsan, andun pa din sa ano ng Pilipino na pag naka-braces
Lalo na sa
ka
mga
and
ano,
retainers, it's a status symbol.
Status symbol.
Yeah.
Sa mga platforms, sa Lazada, may nakikita ko.
So ano yung ginagawa?
Our
ng-
association, the stand of the Philippine Dental Association or PDA, I'm sorry pero talagang hinuhuli yung mga fake na mga do-it-yourself, na mga gumagawa ng mga hindi naman licensed. So, be very careful.
Vigilant and
Oo.
vigilant.
Be aware that these people will just ruin your teeth. And at the end, kayo ang talo. You're going to lose all your teeth. And that's
sa mga
even more
selling
expensive.
platforms.
Yeah.
Paano
Minsan
nyo
selling
na, ano yun?
platforms, kahit yung dentures, binibenta. Parang I wonder how.
Siguro naman we're smarter than
how
that.
is it going to
Hindi naman
fit?
kakasya yun eh. Especially for the denture, it has to be really customized. It's tailor-made for you. Ibang-iba talaga yan. Just like the fingerprints, walang the same fingerprints.
Distinct.
Oo, yeah, it's distinct.
Yeah, huwag niyong, ano,
Interesting ano.
papatolize.
Galing
Interesting kasi may nakita ako sa TikTok na ano yan.
Na-post, di ba?
Yan na post na deliver na daw.
Na-deliver.
Kasya naman.
Napanood ko din yun.
I want to find out
Nag-deliver na
kasya
yung
naman.
denture and then nag-smile siya and then funny yung itsura. Nakakatawa ako ng tawa.
Ano,
May snap-on rin na tinatawag. I don't know if
Yeah,
you-
I saw
So
that.
snap-on, so your teeth kunyari they have diastema or spaces in between, and then you order the one that can just go on top of your teeth. Paglabas mo, mukha ka ng Ace Ventura.
And besides,
So you
sabi
think
nga,
it solved the
it's
problem.
customized. Eh. How would you know that the one you're buying, maybe it's the, you know, the ideal shape or something.
yung mga
Good luck.
implants, okay lang ba yun?
Oh yeah,
Yeah,
implants are the
implants.
best. It's a very good investment. So
Okay.
when you have like 4 implants already in the future, when you lose all of your teeth, we call it all on 4. The dentures can just go on top of the 4 implants, and you can chew very well. Kahit matanda ka na.
But
Diba?
that entails a complicated procedure.
Oh yeah, it's
It's
surgery.
Surgery na. Ano. Parang inaano.
You
Sinuscrew.
screw on the jawbone. And it's our oral maxillofacial surgeon who does that in our practice. Or a
It
dental
takes
surgeon.
How long?
Procedure.
For the whole procedure.
Again, it depends. It's a case to case. When you have bone loss, severe bone loss, we suggest you put bone graft prior to any surgical procedure before putting on the dental implants. Pero maganda ang implants. It's a bit pricey lang kasi mahirap talaga gawin.
Basically, yung implant itself, pagkalagay po, it has to heal minimum 6 months para
Has to
malagay yung
integrate
final
on the bone.
restoration.
Hindi mo pwedeng yung kagat.
Hindi
Pwede
pa
po.
pwede.
Ay,
hindi.
Pagbago.
6
Pagbago.
months.
6 months. You have to wait for 6 months
For
para
bone regeneration.
malagay po yung final restoration.
Kailangan
The jacket
soft
crown.
ang ano.
The jacket
Yeah,
crown
soft
itself.
pa yun eh.
So ang tagal pala ng ano.
Yung may healing type po talaga.
So it
down.
should integrate on your bones, on your jaw bones, for bone regeneration.
So meaning the patient pag nagpa-implant, since sabi mo nga Doc Lito na 6 months. So meaning hindi mo na siya maglalabas
Ay,
because
ma'am, ano po yung
lalagyan.
It's either
Temporary.
we'll provide a temporary dentures or
Call it
temporary. Kung
provisionals.
naka-jacket man na before, tapos nilagyan ng implant, we provide a temporary bridge din para makakangiti naman the patient.
Akala ko talagang ano confined ka to the sa bahay because of the the healing time.
Yan na ba yung pinaka-advance na kunyari na walang ka ng ipin
I would say
implant?
Yeah. Yes po.
Wala yung magre-regenerate.
Well, yun ang wala talaga, wala pa. Kasi it takes a lot of
It
time.
prevents bone loss, ang implants. So, okay rin siya. So, hindi bababa yung mga bones natin.
Hindi magre-recede yung
Recede.
yung jawbone.
So,
The structure
Parang
is the jawbone, the maxilla or the mandible.
Parang natural na din.
Yes.
so ang usually we suggest pagkabunot, lagyan na kaagad. So, one time, big time. Para,
Immediate
Yeah, immediate na.
implant.
So this is
To replace it
so
at
this
once.
is different from the previous practice pala na ano na.
You have to
Diba,
wait
pag
now.
binunot, kailangan mag-heal bago susukatan kasi
Oo, iba na. Oo.
alright.
Ito, pagkabunot, lagay mo na kaagad.
Oo. Noon kasi
Noon, mag-aantay ka pa,
Oo.
diba?
Oo.
Ito hindi na. Kasi you wanna take advantage of the
Yung
kasi,
healing process.
yeah, the healing process. Pagkabunot, there's a socket that's left, right? Where the tooth was extracted. So, doon na ilalagay yung implant, doon sa socket na binunot. And then, we just put a little bone graft to integrate the bone para tumigas yung implant. So, you wait a couple of months bago mag-regenerate yung bone around the implant.
Bone graft.
Bone graft,
That's
yes.
something exotic.
Yes.
Ano ba? Ano ba yun?
Tanong natin, Chito, ang ating mga doctors. How many dentists are there in the Philippines?
Oh, that's a lot.
There's a lot.
It's a big number eh.
Oo nga.
Are there more dentists?
Makita niyo lahat ng kanto, di ba,
Oh,
may
yeah.
dentist.
Are there more dentists than
Medical
doctors,
doctors.
medical doctors?
I would think so. I would think so.
Kasi parang ilang years ang dentistry?
6 years.
6 years. At
Yes.
pareho din.
Plus board exams. Of course, you have to review for at least.
6 years kasama yung undergrad, right?
Yeah.
Kasama na yun.
Kasama yung undergrad.
Pre-dent course.
Tuloy-tuloy na yata ngayon eh, di ba? Wala yung...
Well, during our time.
Oh. During our time.
During our time.
What do you mean tuloy-tuloy, Doc?
Parang
kasama na
before
siya
ho
sa-
kasi there are 2 years of pre-dental.
Pre-dent.
And then after that, you graduate from pre-dental. Pre-dent, you go into proper. 4 years of dental proper.
4
So,
plus 4?
So 4 plus 2, 6.
4 plus 2.
Yes. So ngayon parang ano na yata ngayon eh, no?
Pareho pa din yata.
So kailangan mo ng 2 years and then yung...
Yeah, oo.
6
Ayun.
years pa din.
6 years.
Basta
pa
6
rin.
years pa rin ho ngayon.
Okay. Hindi siya parang yung intermed that, you know,
Ay,
you
hindi
get to
po.
be a
Sa
doctor.
UP, yeah, intermed.
That's the big difference po with us sa doctors. Kasi kami, after you graduated with the 6-year course and then you pass the
Board
exams, you can practice na. Wala na kaming kagaya ng doctors na they have to do internship,
Internship,
residency.
residency.
Yeah. That's why you can see a lot
Thank
of
God.
clinics. If
Kaya nga
you're
mas
born
madaming-
to a rich family that your dad and mom can provide you a good clinic, pwede ka na magtayo.
Practice.
So tanungin natin, speaking Doc Lito of, you know, yung journey of, you know, from graduating from dental school. I mean, mahirap din ba? I mean, to start your own practice.
Well, yes po, kasi medyo, syempre, pag nasa real world ka na, sinasabi ko nga po doon sa ibang junior dentist namin na, sabi ko, alam nyo, yung inaral natin sa school, it will be all different pag nag-practice ka na. Ibang-iba. Para lang talaga tayong pinractice doon. Kasi pagdating mo dito sa real clinic, yung pasta, iba itsura. Yung parang hindi siya basic. Kasi kung ano lang po yung sa school, basic lang talaga yung tinuro sa amin. Eh. Pero pagka nag-practice ka na, iba na yung
So it's a different
it's really a different story when you do your private practice. Although the basics are there, but still, you have to have the ability to, alam mo yan, compromise everything and then parang yung abilidad talaga na yung papasok eh. Especially with dealing with the patients. Kasi marami talagang klase ng patients. May mga patients na mabait, may mga patients na sabi nga namin kanina parang they're expecting more. Parang minsan pwede mo siya sabihin na natatandaan niyo po ba kung saan tayo nagsimula? Kasi maganda na po kayo ngayon.
Ano din, I mean, being a doctor or, a medical or dental for that matter, kailangan din ng psychology,
Yes,
Yes.
that's true.
Yeah.
Yeah.
Kasi you're dealing,
Si Doc Mia po ang magaling siya.
kasi
Psychology.
you're dealing with, patients na, iba-ibang ugali, iba-ibang,
Expectations.
Expectations.
yeah, expectations.
You have
So,
to tell them that you have to be ready, like, to see kung hindi na-meet yung expectation, how will you react? So, yun. So, we interview them prior to the treatment.
Kaya usually, kasalanan ko rin minsan yan. Yung dentist na kayo, pinapabalik ka for a certain period.
Hindi babalik.
Hindi na babalik.
kasi okay ka na, feeling mo okay na.
Kala nila okay na. And then the problem returns again, comes back again. So, sinasabi namin, we told you to come back, di ba? There's a follow-up check-up. We usually do that kasi because we know what's going to happen at the end.
In your recall, doctors, meron na bang cases, in the Philippines ng, dental malpractice? Kasi mas madalas na naririnig namin na medical malpractice. Meron din bang cases?
Meron
of-
din. May mga,
It's a common thing.
And I mean,
Medical, dental, lahat
meron
naman,
bang
even in
na-convict
law.
na of dental malpractice in
Oh, like the doctor, di ba, recently?
si Doc,
Parang impostor na
Si Doc
they
E.
Yeah,
pretend to
usually
have a
unethical. Oo,
license.
yeah. Na ma-revoke yung license, di ba?
may mga
In dentistry, parang I've not heard of anything. It's more of medical malpractice yata. Yung sa yun yung mga naririnig, very common.
Yun kasi yung mga invasive
Yeah.
invasive na surgery. In dental kasi it's just in the oral except if you're doing that implant.
Yes.
Is there a case na
Less invasive.
dinimanda yung dentist?
Siguro meron.
Meron, you haven't
We can
heard.
always justify naman at the end why the procedure was not done properly. Baka may complications. We can always, siguro explain our side. But nothing really I've not heard. Kasi from the PDA, we know what's going on, what's happening in our practice, in our, association.
So parang doktor din ng they cannot practice abroad. I mean,
Oh, no.
you have to get a license.
Yes,
dun
prior
sa
to
abroad.
practicing abroad. Yeah.
My question.
Tsaka
Why-
reciprocity. Yun.
Why did bakit yung inyong preference is to practice your profession
Aesthetic.
in the Philippines? Kasi marami dyan, di ba? There are even doctors who go abroad. Bakit? Why did you opt to practice dentistry in the Philippines?
We like the Philippines.
We love the Philippines. Ma'am, we were given the chance to do our continuing education abroad. So in the US, in Europe, but we still prefer to come back home.
Saka I think, ma'am, kasi pagka, siguro nasa nasa, like yung mga classmates namin na way back in school pa lang, talagang naka-instill na sa mind nila na they want to practice abroad.
Oo nga.
Any profession naman siguro ganun din eh. Siguro dahil lang siguro with kasi kaya kami nagkasundo, we have the same family background. We all love our families. So siguro parang hindi sa akin hindi ko naisip na after I graduated, I will go abroad and to practice. Parang wala yun sa akin talaga eh. Pero doon sa mga classmates ko, lalo mga barkada ko na nasa abroad din, we have barkadas din na talaga, di ba? Mia, and
Practicing.
talagang way back from school pa lang, naka-instill na sa mind nila na, mindset nila na, after I pass the board exams, I will go abroad and practice there. So, nandun sila sa States ngayon. Ayun.
Pero I believe financially rewarding naman sa mga dentists.
Lucrative, kumbaga.
Dito rin naman basta masipag ka lang. Anywhere naman, I would think. Diba?
Yeah, I mean, yung mga,
Tsaka, yeah.
mga Filipino dentists.
Oo, yes. Yeah. Basta for us, number one is passion. Passion to serve and to bring about the best workmanship to offer, especially to the Filipinos. Kaya usually, OFW, they come here. We really give the best service kasi pinaghirapan nila yon. And Pilipino yung pinagsisilbihan namin. Diba? We give back. We give back, yeah. Especially to the Filipinos.
May question din. Kasi, di ba usually in the family, sa family meron kami isang engineer, may isang doktor, medical doctor. Pero question ko, kasi mga katribu, by the way, Doc Nelda and Doc Mia are sisters. So bakit dalawang siblings in the family dentista?
Actually, we're the first ones in our, our whole clan. Yata, kami yung first
Ano yung
dentist.
pinag-usapan niyo?
she's diba? Ever since she's
I've been wanting to be a
wanting
dentist. I don't know why. Man. I guess I was inspired by my dentist, by our family dentist. Kasi napakagaling niya, tsaka very, very neat, very OC. Nakikita ko yung work in a way, parang influenced us. Gusto ko, I like her work, I like the way her work ethics. Na-inspire lang ako.
nagandahan ka, in short.
Nagandahan din ako sa niya, sa mga...
Maganda kasi siya noon.
Maganda rin siya. Sabi ko,
parang
sabi ko, she's my idol. If I'm going to be a dentist, she'll be my peg. Ayun, so, tsaka mahilig ako magkuting-ting.
Iba sa impression ng iba na natakot sa dentist.
Ay, ako hindi. Gusto ko mag-dentist. Tsaka I love the smell of alcohol. Pag nag-alcohol siya after, ayan na, sarap. Hindi ako natatakot. Hindi ako nasasaktan.
So nahawa mo lang si Doc Mia.
Kasi we're very
Hindi, kinapi ko lang siya.
We're very close, yes. It's just the two. She's my only sibling. Yeah, so, yun, very close kami. So, thank you, Lord, naman. At it worked fine for the both of us.
Yeah. And you're,
Yeah.
you're in one, you're sharing the
Yes.
same vision
Yes.
for CAD.
We share the same vision.
And
all
plus
of us.
now kasi, that's what we try to, parang, sa patients namin, na you don't have to be scared to go to the dentist. Parang gusto namin, best friends tayo, ganyan. You can tell us kung may reklamo ka, you won't be scared of us. Parang friends, ganon.
We become friends now with all of
We
them,
have
most of
patients
them.
pumupunta sa
Nakakatuwa.
clinic para lang
Wala lang, chumitsika
makipagtsikahan.
lang.
Yun. Gusto namin ganun na. Hindi yung pupunta ka doon, matatakot ka na magsasabi na, ay, doc, ganyan. Ngayon, gusto namin, friends tayo. You tell me kung ano yung
So,
ayaw mo
eradicate
sa
the
work. Yeah.
fear.
Parang there's
It's a safe space.
something beyond, the professional level.
Exactly.
Correct.
Kasi before, naalala ko yung dentist namin, takot na takot ako sa kanya.
Oh, you
Like, I
first,
can't,
no?
no? Parang,
Diyos ko,
matatakot ka talaga magsabi na, Doc,
Nanonood.
masakit ako.
Nanonood si dentist ngayon.
Hi, Doc! Hi, Doc! Yun. So,
Well, gone are the days
oo,
na nga.
yeah.
Iba na ngayon ang dentistry. It's very modern. It's very, should I say, friendly. Yun na nga.
Does the CAD
Patient
also
friendly.
cater to, children?
Yes, we do. In fact, we have a specialist. She's called a pediatric dentist. So yun, sedation. Kung naririnig niyo po yun, if you're familiar, we do oral sedation for the children. And adults alike. Kasi may dental anxiety rin na tinatawag. So we
Dental
call
phobia.
it a dental phobia. Pag ganon, tinutulungan namin sila to go through the procedure na tulog sila. Because we call it oral sedation. We have an anesthesiologist to do the oral sedation. So the patient won't feel anxiety during the procedure.
Pag-gising, tapos na.
Tapos na.
Nagawa na.
Kahit anong procedure yun.
Yes, sir.
So
Especially
like,
dental implants or any surgery, for that matter.
meron palang gano'n, dental phobia.
Oo.
Anong
Madaming ganun.
Ano yung extreme that someone with dental phobia?
Marinig pa lang nila yung
Yung
drill, yeah.
Or
As in
minsan
panic
papasok ka
na.
pa
Or
lang.
papasok pa lang.
Yeah.
Nakakatakot talaga pag nadidinig mo.
O kailangan mong i-clamp, may gano'n?
Hindi naman.
Hindi naman i-clamp, pero
Grabe yung imagination.
Kapilitan na yun.
Grabe yung imagination.
Baka masuna kami naman.
or minsan in the operating room, nag-OR talaga. We do the we go inside the OR, operating room, to do the dental procedure.
May question ako. Kasi there are clinics, dental clinics that, you know, of course they have partners na ano, na mga dental lab. Okay. But then, may mga clinics then that they have their own laboratory. So, ganun din ba in the case of CAD? Do you have your own lab?
We have our go-to technicians, yes, who does for CAD.
Okay.
Technician.
Yes.
Alright. Kasi minsan, parang yun yung, may mga nakakausap ako that, parang yun yung concern nila.
Yes.
I mean, mas napapamahal daw sila if hindi in-house
Yung technicians, lab tech.
technician.
That's
Or
right.
parang,
That's true, ma'am.
I don't know, sinasabi nila, ay, dapat may sariling lab yung clinic para kasi mas mahal daw.
Yes, true.
Alright. So, totoo pala yun. So, ano pa nga ba? What would be your, if, I mean, meron tayong mga katribo dyan. Sa dinami-dami ng dental clinics ngayon, offering different services, and then may mga may mga sari-sariling claim yan. We're the number one. Come to us, blah, 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 blah. Ano ang distinct sa CAD? I mean, on TikTok lang, on social media, dami nakikitang mga iba-iba. So,
Well, our claim to fame naman talaga is our CAD ultra-thin veneers. We really, I think, pioneered in the field of veneers. And I think kahit yung mga dentista, alam nila yon. We really take pride in our CAD ultra-thin veneers.
The quality.
Yeah, because in Asia especially, we are the leading dental clinic who can offer one of the best and natural-looking veneers. That's why we have a lot of fly-in patients around the world.
Ako, I would say it's the three of us.
Also,
Kasi,
maybe.
I mean,
Without the three of
Yes,
us, it will not be possible.
diba? Parang, we love our patients. We give them TLC. As in, you know, you won't be scared to go to us. As in, we'll be your friends. Yun. I think that's our edge. That's our difference
And
from
it's-
other
it's-
clinics.
The chemistry and
It's- yeah, parang we bond with our patients.
You all seem to be enjoying doing your...
That's
Oh,
true.
yes.
Every day, we enjoy. Ako, I look forward talaga. When I travel and then namimiss
That's
ko na
important.
mag-clinic.
oh, really?
Weird naman.
Parang
pero
hindi reprieve.
I wanna be with them. Ang saya eh.
time.
Siguro the atmosphere, di ba? It's fun and everybody's just very light. Napakagaan sa clinic. Pag ganun, di ba? Everything follows. Everything will follow.
How about si Doc Lito?
Si Doc Lito.
Doc Lito naman.
Yeah. Di, masaya lang po talaga kami sa clinic.
Yan, ganyan. Para kaming joker every
Lahat
Pag may
talaga,
problema,
dinadaan
sige,
lang
tawanan
namin.
lang.
Dinadaan lang namin sa tawa.
Oo.
Tapos, we treat our patients talaga na. Minsan nga po, psychiatrist na dating namin.
Ito na naman talaga.
Kasi sometimes we...
Slash psychiatrist.
Kanyari,
Dentist slash.
kakamustahin namin. Minsan, di ba, Doc Mia? May kinamusta siya dati. Umiyak bigla.
Oh. Na-trigger pala may
Kasi yung pala may pinagdadaan.
Okay.
So,
Burden.
aside from giving her the dental treatment, nag-psychiatrist mo na si Doc.
Psychiatric treatment.
And that's okay, di ba? I think that's part of the job.
Actually, doon kami
Ako, I
nag-enjoy.
enjoy it.
Kasi maraming marites.
Maraming kwento, maraming learnings, you know, from
yes,
other people's
yes.
stories. Yeah, that's right.
Masaya.
So now is your chance to, you know,
To spread the word.
to spread the word of CAD.
Again, Ma'am Gigie and Sir Chito, thank you very much for having us. It is our pleasure to be here. So we'd like to invite everybody. Hindi po nakakatakot pumunta sa CAD. At hindi po it's not true that celebrities lang. We don't only cater to celebrities. Because when you walk into CAD, kayo po ang celebrity. So please come and visit us at our newly relocated branch in Shangri-La at the Fort in BGC. We're inside the hotel. And another one in Green Hills Mall. The same building as Wildflower. See you there.
See you.
And your business hours.
Walang business hours, ma'am.
By
Basta may
appointment.
appointment kayo, we are going to be there. It's
I
usually
suppose
10 to 6.
you have
but
your
when you-
social media page then.
Yeah, our social media page is at CAD Clinic.
Instagram.
That's our Instagram. And the same as
Facebook.
Center for Advanced Dentistry.
Center for Advanced Dentistry for the Facebook.
TikTok is CAD Clinic. _ CAD Clinic.
Nagti-TikTok din kayo.
Oo.
Siya magaling si Doc Mia. Is that TikTok queen.
Pagkatapos
She's the
nga ng,
queen.
ng
TikTok tayo.
straight talk, titingnan ko yung TikTok ni Doc Mia. Alright, thank you doctors for an enlightening discussion, and thank you mga katribu. Tune in again next Wednesday for another episode of Straight Talk. I am Gigie Arcilla.
And once again, I'm Chito Lozada. Watch Straight Talk every Wednesday at 10 a.m. on Daily Tribune's YouTube and Tribune Now on the Facebook page.
Okay. Thank you,
Thank
Doc
you.
Chito, Doc Mia, and Doc
Thank you
Nelda.
mga ka-tribune din. See you.